Hello everyone, welcome to Pediatrics and Neonatology. This video is about bone tumor osteosarcoma. Primary malignant tumors are uncommon in childhood. Osteosarcoma account for 60% of the cases and it occurs mostly in adolescent and young adults. It has a male predominance. Now, osteosarcoma is the sixth most common malignancy in the childhood and it ranks third among the adolescent and young adults. Malignant transformation may be related to rapid bone growth during the adolescent growth spurt. Now, patients with osteosarcoma are usually taller than their peers. Osteosarcoma occur most frequently at the sites where the greater increase in length and size of the bone occurs. Osteosarcoma occurs at an earlier age in girls than the boys, corresponding to their earlier growth spurt. Now, the metaphyses of the long tubular bones are primarily affected. The distal femur account for more than 40% of the cases, and proximal tibia, proximal humerus, and mid and proximal femur follow in frequency. Now, the cause of osteosarcoma is unknown. However, certain genetic or acquired conditions predispose patients to the development of this tumor. Patients with hereditary retinoblastoma have a significantly increased risk for the development of this tumor. Osteosarcoma also occurs in Li-Fraumeni syndrome. It is a familial cancer syndrome associated with germline mutation of the p53 gene. Then Rothman-Thompson syndrome is a rare condition which is associated with short stature, skin telangiectasia, small hands and feet, hypoplasticity or absence of thumbs, and a high risk of osteosarcoma. Now, osteosarcoma can also be induced by irradiation for Ewing sarcoma, craniospinal irradiation for the brain tumors, or high-dose irradiation for other malignancies. Other benign conditions that can be associated with malignant transformation to osteosarcoma include Paget disease, enchondromatosis, multiple hereditary exostosis, and fibrous dysplasia. The cardinal sign of bone tumor is pain at the site of involvement, often following slight trauma or sprain. There is also swelling or a mass formation. There may be fracture through an area of cortical bone destruction. Now, additional clinical findings may include limp, limitation of motion, joint effusion, tenderness, and warmth. Systemic symptoms such as fever and weight loss are rare. Now, in osteosarcoma, results of the routine lab tests such as complete blood cell count and chemistry panel are usually normal. However, serum alkaline phosphatase or lactate dehydrogenase values may be elevated. Now, X-ray findings show destruction of the normal bony trabecular pattern with indistinct margins. In addition, periosteal new bone formation and lifting of the bony cortex may create a Codman triangle. A soft tissue mass plus calcification in a radial or sunburst pattern are frequently noted. Now, MRI is more sensitive in defining the extent of the primary tumor and in many centers has replaced CT scanning. Now, the most common sites of metastasis are the lung and the bone. Now, a CT scan of the chest and bone scan are essential for detecting metastatic disease. Bone marrow aspirates and biopsies are not indicated. Despite the rather characteristic radiographic appearance, a tissue sample is needed to confirm the diagnosis. But placement of the incision for biopsy is of critical importance because a misplaced incision could preclude a limb salvage procedure and necessitate amputation. So the surgeon who will carry out the definitive surgical procedure should only perform the biopsy. Now, different studies have shown that 50% of the patients receiving surgery alone develop pulmonary metastasis within 6 months after surgery. This suggests the presence of micrometastatic disease at the diagnosis. Now, adjuvant chemotherapy trials have shown improved disease-free survival rate of 55 to 85% after 3 to 10 years of follow-up. Now, osteosarcoma are highly radio-resistant lesion. For this reason, radiation therapy has no role in its primary management. Chemotherapy is often administered prior to the definitive surgery. This permits an early attack on the micrometastatic disease and may also shrink the tumor, facilitating a limb salvage procedure. Now, chemotherapy that is used in the treatment of osteosarcoma include doxorubicin, cisplatin, high-dose methotrexate, and ifosfamide. Definitive cure requires en-bloc surgical resection of the tumor with a margin of uninvolved tissue. Now, contraindications to this limb-sparing surgery include major involvement of the neurovascular bundle by the tumor, immature skeletal age, particularly for the lower extremity tumors, infection in the region of the tumor, inappropriate biopsy site, and extensive muscle involvement that would result in a poor functional outcome. Now, before the definitive surgery, patients with tumors on the weight-bearing bones should be instructed to use crutches to avoid stressing the weakened bones and causing the pathological fracture. Now, for patients who require amputation, early prosthetic fitting and gait training are essential to enable the patient to resume normal activities as soon as possible. Now, post-surgical chemotherapy is generally continued until the patient has received 1 year of treatment. Relapses are unusual beyond 3 years, but late relapses do occur. Now, histologic response to the chemotherapy is an excellent predictor of outcome. Patients having 90% tumor necrosis have a 70 to 90% long-term disease-free survival rate. Other favorable prognostic factors include distal skeletal lesions, longer duration of symptoms, age older than 20, female gender, and near diploid tumor DNA index. Now, long-term follow-up of the patient with osteosarcoma is important to monitor for the late effects of chemotherapy, such as cardiotoxicity from anthracycline, that is doxorubicin, and hearing loss from cisplatin. Now, there are some patients in which late isolated lung metastasis developed. They can be cured with surgical resection of the metastatic lesions alone. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos related to pediatrics and neonatology.